For the first time, a patient has received a custom, 3D printed titanium implant to replace part of his rib cage. The 54-year-old Spanish man had chest wall sarcoma, a cancerous tumor that grows in the chest wall and, in this case, had grown around his sternum and part of his rib cage. To excise the tumor completely, surgeons also had to remove that part of his skeleton. The rib cage also is complex and difficult to replicate. Usually in cases like these, a flat titanium plate is used to reinforce the structure of the rib cage. These aren't an excellent option. They can come loose and increase the risk of complications. But 3D printing is now at a point where it's a viable option for quickly creating custom implants designed specifically for individual patients. The patient's surgical team at Salamanca University Hospital in Salamanca, Spain, commissioned Melbourne, Australia-based medical device company Anatomics to create a customizable titanium implant that could replicate the complicated structure of the sternum and rib cage. The team used high-resolution CT scans of the patient's chest to recreate a model of the chest wall and the tumor that was attached to it. This 3D model allowed the surgeon to accurately plan where to cut the patient's rib cage.